Welcome to Soul Science, the official podcast of Sports and Exercise Podiatry Australia. We're your hosts, Pat and John, both sports podiatrists with a passion for advancing the profession. In each episode, we dive into the latest research, share compelling stories from clinicians, and feature special guests who have made significant contributions to the world of sports and exercise podiatry and lower limb sports medicine. Today, we're recording live from the 2025 ASICS SMA Conference in Hobart. John, how are you?
Great. I'm enjoying learning. I'm enjoying the surroundings. Beautiful place, Hobart. And I believe this is our first live episode.
Well, I'm very excited to step right into it today. Today we have two guests. They're both elite athletes turned clinicians, combining years of experience on the track with deep expertise in biomechanics, running performance, and injury management. We're thrilled to welcome Thomas Do Canto, a sports and exercise podiatrist and elite marathon runner, whose unique blend of clinical expertise and athletic experience makes him one of the most respected voices in running performance in Australia. Thomas is the director of Pinnacle Sports Podiatry in Sydney, where he works with runners ranging from recreational athletes to Olympians, helping them return from injury and reach peak performance. The 2024 Australian Marathon Champion, Thomas has represented Australia internationally and boasts an impressive marathon personal best of 2:11:51. Reflecting his deep understanding of physical and psychological demands of endurance sport. With a dual background in exercise and sports science and podiatry, Thomas integrates evidence-based biomechanics with first-hand racing experience, bridging the gap between elite sport and everyday clinical care. Michael Nitschke, our second guest, is a certified sports podiatrist and partner at Spark, the sports and arthritis clinic in Adelaide. Alongside his clinical work, he's an accomplished middle-distance runner with a 1,500-metre personal best of 3:59. Bringing the athlete's perspective into every consultation, his work focuses on running biomechanics, footwear, load management, and recovery, helping athletes optimise performance while reducing injury risk. Through his work with athletes across all levels, Michael is known for translating complex data and lab insights into practical, actionable strategies for performance and rehabilitation. Both Thomas and Michael have curiosity, precision, and passion for the sport, continue to how to shape sports podiatry and how it supports runners today. So everyone on this podcast gets asked the same question. What does sports and exercise podiatry mean to you, and how has that definition evolved throughout your careers? Mike?
That's a good question. Like, I got into podiatry because of my history of running and love for footwear but I reckon maybe the profession's probably evolved a bit more. There's a bit more, I think podiatry is sort of seen to have an impact now, especially on sports, more than when I first started. I'm in my 20th year next year. And so I feel like within the population or general population, we've been seen to be the experts of lower limb biomechanics. Whereas when I began, we probably did blend in a bit more with other professions. Tom, I'm not sure if you agree that maybe we are a bit more pronounced and moved up the hierarchy of importance for in the area of sports, but I think we sort of have.
Yeah, I think I'd agree. I've got a pretty similar background, I guess, with you with. Getting into podiatry because of my background with sport and sports injuries and seeing a podiatrist myself at a young age. And that exposure was a positive one. So it's a common story, I think, a common thread with people getting into professions when they have experiences with that profession, positive ones. And yeah, I can say it's evolved and it continues to evolve, and it's exciting to be in a profession that is evolving so rapidly.
So just getting on to kind of your first steps in podiatry, how did you kind of transition from and apply your kind of experiences as runners and kind of people in the running world to your work as podiatrist?
Yeah, it's good. I mean, it's part of the knowledge you get is from in-field, from experiencing running and being in that sort of environment for a long period of time. And I know just before I graduated as well, I actually worked in retail and footwear, and that was just to get a job as a student, for example. And that made a huge impact on sort of how I practice and my passion for podiatry as well. So the transition was pretty flawless. Like I felt that, part of what I do clinically now, I was doing, working in retail, and it was very similar to when I was running and trying to manage my own problems selfishly enough when you're a distance runner. And then suddenly, organically, you mix that with the evidence you learn both undergraduate wise when you go through the pathways and then move in towards practicing with practitioners next door have a similar interest to you, and then suddenly the worlds collide, the evidence plus your practical experience sort of merge a bit. And that happened pretty quickly for me in the profession. I was pretty happy. And then I moved into my own practice within, I think, 2 years of practice, just because I felt like I knew what I wanted to do. But then I had to go out and search for my own education a lot more. I didn't have quite as much mentoring. And in 2006, when I first did that, like there wasn't a lot of mentoring available. So
I mean, yeah, I don't really. You covered a lot there, Nita. I have a lot to add. Uh, yeah, I mean, similar situation, similar boat that I've been in. I would say I am still trying to mesh both worlds of like, yeah, my background, the practical application of it, being a runner myself, treating runners, and the evidence, and yeah, it's just it's a yeah, it's just evolving and continuing, and it keeps the job interesting.
Thomas, I'll probably start with you. There's a mental and technical aspect of being a podiatrist and an athlete. Where do you sort of, you can see it from both sides. Where do you sort of draw the line, and how do you kind of communicate, those sorts of feelings when you're treating athletes?
I guess it helps. Like I'm in a lucky position where you get buy-in from the injured runner, because as I say to a lot of my patients that have come in, I've probably had almost every single running injury there is. So I've got personal experience with these injuries. I've got empathy around those injuries, which I think just naturally, helps in that scenario to like sort of relate to them and their injury and just explain what it is and the practical implications.
Look, I'm not an elite athlete like Tom, so I have to work a bit harder for buy-in from the patient as well. So I'm highly involved in the community of running, for example, and that itself, actually being in the community, there's buy-in from patients just seeing me out there throughout the weeks as well, and on weekends, and then Adelaide's a smaller place as well. So I guess what happens is you end up sort of being put into a bit of a box of a specialist in the area. But curiosity, like you have to be curious. Like I had so many injuries similar to Tom as well, and your curiosity on your own injury, for example, leads you to investigate not just the best evidence, but also how you felt at the time as well. And I think that information collectively together, speaking to the patient, is really important in getting people to have buy-in, but also it shows empathy. And when we're dealing with not injuries, when we're dealing with people with injuries, that are people first, and the empathy side of it still trumps a bit more of the knowledge to collect the buy-in.
I guess moving on to your kind of careers as podiatrist, how did you kind of balance the kind of demands of being athletes and being in that running world with your desire to grow businesses?
Slowly is the answer. Like I obviously I still liked, I spent my early days running professional running, which is things like the stool and base Sheffield. That was an easy thing for me to be able to do. I ran shorter distances, 200s, 400s, and 1500s. My training schedule was probably more like 5 to 6 hours of running for the week, so not high training like Tom was doing. But I began my own business after a couple of failures working in private practice for other people, in terms of like just maybe matching ethos of the practitioner and stuff. I had a bit of disillusionment in the profession. I really liked working in retail, but it just wasn't living up to expectations when I was working clinically. And so when I decided to do my own thing, I had really good assistance from physios locally, and I just did it slowly. Like I opened up a clinic and I worked 1 or 2 days a week. I would set my CPD calendars up to try and I remember going to my first SMA conferences and stuff and before 2010 to try and just learn from everyone, and that was a big piece of just trying to develop it. But staying in the community for running, like that was a big part of being able to show my skill set of being able to educate people in that realm. And that took time. I reckon it took me 5 or 6 years to become established in terms of, one, being confident in what I could offer the community as a podiatrist, but at the same time, it was fun. Like it was a fun process. I didn't feel overbearing. I wasn't overworked. I didn't make as much money, of course. But I didn't live a lifestyle which required that either. So I think I found it to be quite progressive, and I think it sort of innately happened. I'm not necessarily the hardest worker in the world, but I like to try and keep things relatively systematic through the week and consistent.
Yeah, again, similar sort of situation. I working for someone else. Gradually worked less in private practice for someone else, and started my own practice. Was able to set my own hours. Didn't have the early days, didn't have the financial constraints that I do now with a mortgage and a family, etc. So I was able to not I was able to train at the same time as have reasonable working hours and fit the training in. It's a little bit harder now to fit the training in, but I got a very understanding wife that enables and facilitates, organizes my life to fit the training in. So that can't be underemphasized. It's pretty good. But yeah, it was a transition. It's evolving now to the point for many years being just in my own business, but it was probably a transition over several years working for someone else to full time my own practice.
All right, let's talk about the psychology of performance and injury. For a lot of kids out there, they get injured on a weekend playing sport, and you know, a lot of the time they may have to rest from their activity. Same with runners, trail runners, marathon runners, whoever you want. There is at some point a degree of load reduction and rest, right? How do you approach communicating the context of that injury, and how do you coach humans through the fact that they're in pain and have an injury?
It's a tricky situation. You've got a kid, you've got parents, so there's already two factors there that you have to sort of navigate, and the way you're trying to communicate, depending on the age of the kid, obviously, but you're trying to really, I try and talk to the kid as primarily and explain what situation they're in, and obviously you including the parent in that and trying to get buy-in from both, which is extremely tricky thing. Still working on it. It's something that is hard, and kids they don't like often. Well, sometimes they do want an excuse not to. Occasionally they want an excuse not to be exercising, or so that to some extent that's the other side of the spectrum. But then you've got very competitive kids and very competitive parents, which it is a tricky part that I'm still struggling to navigate. But I guess setting you kind of find the personalities of these people, and sometimes you got to set some hard boundaries and be a little bit more just tackle the situation a bit differently based on whether you think they're actually going to take on board your advice, or try and push the limit and push the kid to get back a little bit faster.
I think Tom nailed it there in terms of like matching the personality with how you're going to deliver the news and the outcome. And often we find people who are super competitive, almost slightly addicted to routine at younger ages, and we see injury risk. But explaining to them that like the association of them performing at a high level when they're really young, especially in a sport like running and things like that, it's a bit different. It's not hugely associated to their future. If they have to miss a period of time here, there, and everywhere, you really have to get buy-in. And sometimes I'll show them the numbers on that stuff. Like I remember I wrote a little article on LinkedIn in regards to one of my athletes. We talk about the room to move. You miss a bit of time with training through here as well. That's okay. That's important for you to be able to handle more load in the future, for example. So you need to find a halfway. And it's not that straightforward, especially when parents are involved, because often they want the process to be rushed. They think that, that every now and then if they miss this block, they're going to miss the Olympics 25 years from now. And that's not the association that we tend to see.
So switching gears a little bit, you talked a bit about mentorship and kind of starting out in the profession. Picture yourself as a new graduate, wants to get in the sports world. Where do you go? Like, well, what are your options, and how do you get into it? Because we've got a lot of people keen to be involved with SEPA and maybe a bit more inexperienced in their careers. So yeah, some top tips.
This is a good question, and I'm sure Tom and I might have slightly, hopefully enough to complement each other on the answer through here. And often, sometimes the answer is not necessarily within your profession. I was very lucky to have some mentors externally who were sports doctors, etc., that who were just good at giving time. I'm always amazed every now and then you have some practitioners have so much knowledge and they are happy to give their knowledge. They're so passionate. And sometimes it's not the case as well. So my suggestion for those younger people is to seek out those people that you feel that are good contributors to the area that you want to, and try and touch base with them. And it doesn't necessarily have to be in a podiatric setting. If it's in a sports medicine field, it can be indirect, it can be physio, it can be medicine. And every now and then that person will be gracious enough to be able to offer some time and some advice and push you in the right direction. I love conferences. I just realized this is the first time I've been to one and being able to spend time with a lot of the younger generation of podiatrists, how enthusiastic they are, rejuvenates me a little bit, to be honest, to sit down with people. I'm in my 20th year, and it makes me want to be a bit more motivated to just continue to learn as well. So sometimes the magic that happens between going to the lectures and speaking to people, that's mentorship, and then the relationships are built from there as well.
That's a great point about looking outside of your own profession. I think you can learn a lot looking, a broad lens at sports medicine. That's why conferences like this are so good, Sports Medicine Australia, because you're mingling, you're in amongst all the professions. And yeah, for younger pods, like I guess my own example, and even from what Michael said earlier, like there's only so much you learn undergrad at uni, so there was a huge amount that I had to seek out CPD, had to seek out areas of interest post uni. So I'd say the first several years, there was a lot of, or even during uni, I was back then so eager to learn that I was going to seminars and conferences even while I was at uni to try and absorb as much of that sports podiatry content that I was so keen to dive into when I graduated. I used to do, when I was on the SEPA board, some uni talks about what SEPA is, back when it was absent as well. And it was a little bit, it was disappointing when I would ask at the start, do you guys, who knows about SEPA? And no, occasionally not a single hand would go up. So I think, yeah, obviously uni is a very busy time, but forward planning and like you can, network, and you can be a student member of SEPA. You can, it's I think you can never start looking into your area of interest early enough, and start time dependent, absorb as much as you can.
Gents, what's the biggest setback you've had as a business owner and as a clinician?
I made a transition from running my own small business, renting a room out from a physiotherapy clinic, to taking a plunge and working with a couple of sports doctors. And it was it was the most rewarding experience I ever had in terms of knowledge and developing a business sense. But it was also the most difficult, working in a multidisciplinary point. And when you work with sports physicians, sometimes you move down the food chain a little bit in relation to, your position as in the hierarchy and role. But it allowed me to learn a lot. And like we opened up our sports medicine facility at the time, and 4 years later we had COVID. And as a person working with other business people, one thing, or other people who are partners in the business, we were able to share the stress and share the load. That was really important. While I say it was difficult, we're at the other end now, and it was like it makes things so much easier. But at the time, things were like that, were quite difficult. So pandemics aren't a common thing, so that was obviously a restriction through here. But I learned a lot from it as well. I learned to value my time outside of the clinic then as well. And then since then, I have managed to find better balance in my life outside of work since that period, because it just sort of forced me to do it. And then I enjoyed it a bit more. And I would argue that the time I spend in clinic now, which is probably 10 to 20% less, maybe 15, it might be up to 30% less than what I was working back then, is more efficient. And I offer a better service, I think.
I say probably my biggest challenge as a clinician is being a business owner. I never got into this. Yeah, I never got into this to be in business. I got into it for the pure love of the clinical side, helping people get back to what they do, what they want to do, and what they enjoy. So it's still a challenge, and I don't enjoy it. I don't enjoy the business side of things. But it's a necessity, and there's financial benefit if you can get it right. There's obviously stress that goes along with it. I've kept my own business quite small, partially on purpose, because I don't want to be more of a business owner, and I want to just be more a clinician. But yeah, it's a challenge, and possibly, I guess. Yeah. I probably need to find more more ways to probably be a more efficient business owner. Because again, there's only so much you learn at uni, and that's something that I actually have not had the motivation to pursue post uni, is actually how to run maybe a more efficient business, which at the end of the day is probably going to serve more people. And obviously the classic challenge of just I'm in a position now trying to get a podiatrist into the clinic. That's all, you speak to any podiatrist now that runs a business, it's always a challenge to get a podiatrist.
I'll just add to that as well. Like, I think, yeah, I'm not, in terms of getting into the business side of things as well, it was absolutely the same, the passion to help people, but my business skill set was relatively poor. And same thing, I've chosen specifically to keep the business small. And I'm lucky enough to land one of the previous people you've interviewed, Matt Clark, who works with me now, and he's the future for me. And if I can put as much time and resource into him, he can look after me as I go through my time and keep me up to date with knowledge and things like that as well. And I think that's almost enough for me. I think sometimes even just identifying that if you are going to move into business as well, perhaps maybe people don't need a big business to be happy and successful as well. Sometimes that's the key. You don't need to get more and more and more.
Awesome insights, guys. So I guess getting back to running biomechanics, obviously we've had the pleasure of listening to you guys at the conference this year with your knowledge and insights. What's changing in the world of running biomechanics? And do you think there's a bit of a danger that we kind of we're becoming over dependent on data and losing some of the kind of nuance when it comes to actually working with people one-on-one?
Do you want me to answer this one, or you want to go straight away? Yeah. Look, it's a great question. Like, this is where the experience and the clinical side, I find that being in both worlds really helps. When you go to a traditional running club and things like that, and you see the success you have, and you see the things that people emphasize, which is usually consistency, consistent running, variation of their running. These things are the things that truly matter. And there are details. Like, I remember writing up my hierarchy of important needs to be sustainable runners, and training characteristics and habits of that was absolutely the most important thing. And you learn that by experience in doing it. But then things like, your recovery, the way your tissue stress capacities, your biomechanics and shoes, they play a role, and they may determine if you get injured or maybe your limitation of ceiling of performance to some extent. But they definitely are not as lower hanging fruit as getting the training done as well. But there's a time and place for everything. When someone comes into me and they're really experienced and they have got their training characteristics sorted out, often that person, we're spending more time on the details of how they move and their footwear and the details. But when someone new comes to the clinic, a lot of the time you're trying to give them you've got 30 minutes to have an impact with a person and influence the next week, the next month, the next year, and educating them on the organization of their training and characteristics and what sustainability looks like, arguably is the time we should be spending with patients first and foremost. So you're identifying their experience and then basically reverse engineering the plan along from there, I think.
Yeah, awesome point. So you talking about that sort of reminds me of what's helped me a lot in practice is when I'm treating the runner is just the intake form. So before they even come into the clinic room, I've already got an idea of what we'll be chatting about. So I've got quite an extensive intake form that's separate for runners. Often runners type A personality, they've got a lot of information and they want to impart that information on you and give you as much information as possible to help. And so if you get it in written form, it can be super helpful prior to the consult. It's already written down there for you. They've done that. And so the very start of that form is training characteristics. So you can assess whether you think there's already a red flag there in the sense that maybe they haven't got that quite right. And so I've already got in my mind, maybe we need to chat about this before we dive into all the other questions around footwear mechanics, injury history, and such. So yeah, it's definitely I enjoy the biomechanics, orthomechanical stuff, but often I need to talk about training characteristics.
Now, both of you have lived through the GFC, Hocker, Vaporfly 4%, COVID. So you've been around for a while. So you lived through the rapid rise of shoe development in the last 15 to 20 years. Can you talk more about the demarcation of neutral, stable, minimal, if you will, and then the new, obviously, sort of understanding of daily training, tempo shoes? Where does that now sit as a kinematic comfort and a prescriptive perspective from a podiatrist?
That is a big question. Oh boy. Okay. All right. I'll just go. Yeah, we've been around. We've been around a while now. So I just had a talk on a little bit about the evolution of performance footwear. So I got to do a little bit of a deep dive into it, and just reminded me of the huge changes that have occurred. So we've gone from the days, I guess, even when I started running 25 years ago, where there was a demarcation of motion control, stability, neutral shoes. And it's shifted into less defined segments, which is a little bit can be a little bit confusing if you're just trying to take a very dogmatic approach, which I don't think is the right way anyway. So yeah, we've gone through a period of evolution in footwear and we had this point in 2009, which we had a little publication that became quite popular. Runners asking about it in clinic. It was called Born to Run, and it was all about how footwear is evil, it causes injuries, and we should run like the New Mexico Indians that ran in either barefoot or in very minimal sandals. At the same year, 2009, Hoka launched. So this was sort of the epitome of the maximalist movement. And so yeah, we had a period there where there was a range of minimalist type models on the market, the traditional stability motion control shoes, neutral, as well as these new maximal type shoes. So that was quite an interesting, a lot of options, a lot of confusion. And so there's been a lot of research that's come out that sort of nudged us away from the panacea of that barefoot will fix everything, which it doesn't. It's got utility, obviously. There's utility for barefoot minimalist shoes, but it's certainly not going to fix and solve everyone's running issues by switching to it full time. So yeah, we're now in a place where we've got probably almost too many maximalist shoes. That's what I feel like anyway. It's the pendulum has swung very hard to maximalist. Not only are the shoes are getting higher, they're getting softer. So softer, higher. There's still plenty of options that I would classify as because the segments are not as defined, but we've got stable, neutral shoes. We have still got stability shoes. We don't really have those pure motion control shoes as such, but yeah, I think we have a good range at the moment. Yeah, do you want to add to that, Nida?
Yeah, look, so almost now you're seeing shoes demarcated by purpose a little bit as well. There's still stability features at the end of the day. Things like medial postings and trussic systems have all been removed because they make the shoes a little bit firm, and everyone knows soft is better, hey? So they've moved that way, and we've seen the compensation by making the shoes a bit broader, more safe in that setting as well. But the magic of the foams now can sometimes dictate how you feel and your performance as well. We have shoes that make us feel like we get more pop off the ground. So resilience, they're probably built to run faster and enjoy the run a bit more. And we have shoes that feel more pliable under the ground, for example, to protect, as they would say. I'm not sure it necessarily protects, but it gives you this feeling that paints the picture of protection. You don't feel the ground. So now we are connecting our patients to the right shoe relative to how they're running a lot of the time. But instead of using things, the metrics such as, I guess like medial postings, we're looking at body mass and relating them to the density of the foam. A big person might go into a denser foam because it relates more, and a lighter person might go into a lighter foam. We've seen some literature suggesting that perhaps maybe that'll reduce injury risk as well. So we're using a bit more, metrics that we could take from a subjective history rather than a biomechanical assessment to actually get them to the right shoe without even looking at them move. But then we do the caveats. Some shoes have more forefoot cushioning, more substance and stack height in the forefoot. We might connect someone who's a bit more biased to the forefoot there. And so, yeah, we've got options now. Like Tom says, unfortunately, the options are a little bit more, there's silos within it, but the world has moved towards, I guess, what now our comfort fielder would suggest is higher stack, more pliable shoes. And that's where we're currently at because it makes people want to run more. It's definitely contributed to the running boom. There's no doubt that me doing a workout in really supercritical foam now is more enjoyable than what it was wearing, 2 centimeters of firm EVA under my foot. So I think that's where we currently stand. It's actually fun. It's the most fun part of footwear or the most fun part of the industry change since I've been working. So
yeah, we certainly know all about your love for shoes from your regular appearances on the Inside Running podcast. These guys are otherwise known as the Shoe Geeks, and I can certainly recommend listening to them on a monthly basis generally. Yeah, cool. So just wrapping up this section, we're just keen to understand, from your experience, what's the one what's the one metric or go-to that you use with a runner in terms of trying to understand where they're at and how you can influence their training and injury prevention as a podiatrist?
Probably experience still sits number one as a metric. Years spent in the sport. We know the biggest risk factors in relation to running injury still remain to be they're non-controllable. It's experience and it's previous injury. Can't control any of them, but they have a highlighted aspect of whether they will get injured in the future. And, we don't know if someone's history, for example, actually increases their risk of history because one, the tissue capacity is lower, or perhaps maybe they're just the people that make bad decisions with their training. It could be behavioral that causes the injury risk. So often experience and their injury history are the two things that we tend to take into account. And then when it comes to the specific region, obviously connecting, people have a lot of Achilles and calf issues. There is merit to see how they move. There is a merit to say, oh, look, you're really biased to the forefoot. This may be a risk for you, and try and connect person to the right strength and conditioning protocol, saying, look, rather than changing your gait attributes, let's just prepare your tissue to handle the stress. And then we might connect you with a shoe with a higher pitch, for example, to try and deload that to try and handle some more running. So you can use all those aspects to try and reduce someone's injury risk. Sometimes it's just profiling them subjectively first before you do all the objective.
Again, I probably don't have much to add to that. But yeah, one thing just that came to mind is how you can look at chronic injuries and you can look at reoccurring injuries in a certain body region. And so I'd use that as a way to maybe have a more of a biomechanical lens to treatment, or recommend biomechanical things such as gait retraining, changes in technique, also footwear, specific footwear that may reduce load to that particular body region, as more of a potential long-term tool.
I guess that takes us to our tech and tool spotlight, gait, ways to innovation. So I guess in the last 5 to 10 years, technology has also exploded from, 3D printing, foot scanning, pressure plates, dynamos, all that sort of stuff. Has it truly made us better clinicians having all this data available now? Or are we starting to see technology quite commercialized to the point where it's used as a selling tool?
I'm probably a little bit cynical here. I think the selling tool is a real thing. Unfortunately, a lot of people might have good intentions, but it potentially is not actually. They're not really getting data that is necessarily being beneficial for the outcome. But having said that, I'm fairly old school. I don't really. I use a lot of just visual gait assessments. Simply, my gait assessment is just slow motion video capture from multiple angles, and history in my experience, and just yeah. So I guess I'm biased in the sense that I haven't adopted too much of the technology, so maybe I'm missing the point to some extent of what else I could be doing and seeing that I'm missing. But I think for the most part, you get a lot from keeping things simple. Keeping things pretty simple.
Look, I'm similar in Tom in the sense that I agree a lot of the tools can be utilized as a selling point. I do use a lot of data. Like I track a lot of my runners using metrics along the way in terms of their training characteristics. I often use most of my data to describe habits and not to prescribe, which is interesting because a lot of the time I collect the data and it just tells me more about the person, how they move a lot of the time. And if I collect it, even like pressure plate data, running gait data, and I love little tools. I play with them all the time just for myself first, and then I work out an application for them just to describe something to me. If I think it's a great education piece for the patient, I think it's really, really useful. And there probably is a little bit of application to it as well. There's a time and place, like a chronic overuse injury that's recurring in the same spot, for example, and there's merit to it. I feel like people who are really experienced in field, obviously, it sounds odd as well. It goes back to that intuitively they know that they can hear it. They've seen it 35 times before, and a new clinician may not have as well. And they might make that same decision without the data as well. And I feel like I do that more now than when I first started. It's good to have a lot of data, but I think it's really good there's a lot of noise. And so, but using it just to tell the whole story and identifying things that might be relative to that individual in prescription use is probably a bit rarer than we think, I reckon.
And kind of moving forward and kind of looking at the future of sports podiatry, where do you see technology playing a role in our work? Is it something you think that, every client who comes in will have some form of technology involved in their assessment, or do you think there'll always be a place for the old school way of assessing things?
Bit of both. Patients are pretty good with data, and this is we're in information age. Everyone has information at their fingertips, for example, and they'll seek a way of maybe helping them visualize it. Whether it's even like how many runners do you see without a Garmin tool or Strava based data now, exactly, and how many people do you know that had just self-assess their attributes of how they move before they come in. They sort of describe exactly how they move, and they may not, and we know from data they may not move like that at all. So often our job as an educator is one to take in all their information, but we're trying to push, they've come to you to try and push them in the right direction some way or other. And some of that you can use the data that they have or that you collect, but a lot of the time it's pretty obvious sometimes, clinically and visually. So I think we will continue to get more and more data. The use of AI has become really popular right now. It's definitely the in trend thing as well, both in visual gait analysis and the use of assessment of people's training characteristics and everything. And that's not going to get any smaller sometime. Our job is to be able to work out what is noise and what is relevant. So and suddenly we are trained to be able to dissociate or demarcate the two. You can't ignore it. Like, we need to know how to use the data, because people coming into the clinic, they use the data. So we just got to work out what's relevant and what's not for that person then and there.
Yeah, probably the thing that I've found most beneficial technology wise in my clinical practice is AI. His AI and is using things like clinical like note taking apps. And helping to reduce the burden of like letters, and also just actually giving really comprehensive plans post consultation. I think I've gotten a lot better at it, and I do believe it's actually helping outcomes by getting that comprehensive information out to your patient, email, same day. More comprehensive than I've done in the past, because it'll give me the bulk, and I'll go in there and I'll modify it, I'll tweak it, but all the stuff I've tried to educate them on during the consultation, during that 60 minutes, it is captured, and then it can be less generic, because I'll always have little things that I'll say to that individual that I'm not saying to the next person that comes in, and that's all captured in AI and note taking, and it can just then all be relayed. So I've got no standardized. I've never have used standardized forms. There's obviously all these things that have been used in the past that I've used in other clinics for pathology specific forms that you hand out, you tick boxes, you do the exercises. This is what you do for this pathology. But yeah, I think AI is really helping to make it a lot more tailored to the patient in front of you.
All right, time for our unpopular opinion segment, where we have hot takes from, I guess, our listeners and other podiatrists who've sent in some questions. We're going to get John involved with this one as well. Sure. So the first one, we focus too much on perfecting biomechanics and not developing enough resilient runners who can adapt and perform under imperfect conditions.
I think I'll defer to what Michael was saying earlier in the podcast about the fact that, yes, maybe when we're looking at elite athletes at the top of their game, where we've already addressed those things, then yes, we do need to focus on those things. But for those typical runners who we see in the clinic, understanding the runner is probably the first step to helping them to achieve their goals.
Look, I'll take this one step further, and we'll use an example like, let's say, gait retraining and movement patterns, right? And this is a topic of much polarity, where we know that if someone starts to move a particular way, they will, with experience, economically self-select gait attributes that will be most economical for them. And should we interfere with these? And it's always interesting, because when I have someone who's got a lot of experience, for example, I did drills, I did this workout with Tommy. We did a short workout. Tommy's a marathon runner and I'm a miler, and he still beat me in on the mile repeats yesterday. Before the workout, we go for a jog and we're doing these running drills, ABC running drills and some strides. And Tommy looks really good. Doesn't look like a traditional recreational marathoner, because he's not. He's a really good runner. And I realized that all these subtle things that, people have done for years, like running drills and strides, all these ancillary activities that people do in just general running clubs that we probably don't really focus on clinically, have this ancillary effect in falling over to our running form and running technique. And I really emphasize these attributes and characteristics within running cohorts because it can raise the ceiling of someone's ability to run faster. Not necessarily more economically, they need to keep running more volume and more consistency, for example. I think if you are a practitioner and you think we should not interfere with running gait at all, and if you're a person that thinks you should only focus on running gait and biomechanics, the pole ends are a red flag to me. You need to be somewhere in the middle. There's a time and place for everything. There's a time to not interfere with attributes, and there is a time to really hone in or add something into their training that may actually raise the ceiling for their ability. It may not be always at injury. It may be from a performance lens. It may be from an injury lens or performance or tissue conditioning lens as well. So I think, there's a time and place for us to be, interfering with things such as this, and sometimes it's built on the experience again and previous injury history. So I do want to emphasize that's a point where I think because it's a soft science and we don't have much data and information, it's more intuitive, more artistic than it is scientific.
I think this gets to your question. I hope it does. But last week, it reminds me of a case, a young girl, a runner with a few months' history of patellofemoral pain. She'd been seeing a physio, and she thought she might see a podiatrist, considering that maybe her feet were relating to her knee pain. She'd gone through a regime of strength and conditioning. Hadn't gone through much in the way of gait retraining, but a lot of strength and conditioning. And looking at her run, I explained that she had a very large dynamic valgus running, a lot of femoral internal rotation, possibly a little bit from the foot, but I don't think her feet were a main driver. Regardless, we discussed like the utility of possibly using some prefabricated insoles. But she mentioned something about, I've been doing all this strength training, but then she looked at the video that I took of her and she's like, "What?" She almost cringed and she's like, "Why do I look like that?" And I'm like, you realize the strength and conditioning is not going to change the way you move. It's that will accommodate the movement pattern, but it doesn't necessarily change the way you move. So then we had a chat about possibly using gait cues while she's running to create the change in movement or kinematics that might alter the load. So that was that's an example of where you need to look at all those factors.
Okay, unpopular opinion too. Shoe technology is moving faster than the science. And as clinicians, we're sometimes chasing marketing trends instead of biomechanics. John.
Well, I'd agree with that. Unpopular. I don't even know if that's an unpopular opinion. I mean, I think generally, often as runners, and particularly you guys who are trying on the latest and greatest shoes, we are part of the science. Yeah, our work is what is helping to companies to understand whether these shoes are helping, hindering, causing injuries. Again, these things can often take years to actually find any kind of trends. So, I think that's probably true and not necessarily unpopular.
And sales probably should drive the market. That's their industry, right? They're trying to sell more shoes. And what they're trying to find out is what sells more shoes. And they're not as fast who's running fast. In the industry of making fast shoes, they want their shoes to win races. They want people to buy the shoes. And what makes people buy shoes is usually the experience in the shoe. And that's what's changed. Like how you feel wearing a pair. I use this analogy. I tell the story a bit as well. I moved to Bel Air, which is in the Adelaide foothills, and I was 2021. There's this guy running through the hills. He'd be 120 kilos, and he's jogging in an Alpha Fly One. It's the best shoe on the market. It's historically, it's the goat, and he's jogging in it. And I see him maybe 10 times in a period of about 9 months, and I see him 9 months later, and he's lost about 15 to 20 kilos. And I just, out of interest, have to stop him and say, "How do you find the Alpha Fly, mate?" And he just says to me, he says, "No, I wouldn't be running without it." They said, "I don't feel the ground. It's fantastic." So this guy's picked a shoe because of his fun, his comfort, and he's lost a bit of weight. He's lost 20% of his body mass, for example, and he's doing it. This AFT, this advanced full head tolerance, got this guy running because it's like an e-bike. Getting on an e-bike just so you can climb the hills, it gets you on the bike. It's really, really important. So more people wearing shoes is good because more people are running, and running is good.
Love that story. I've heard that a few times. It's a good story. It's a good story. I think our job is to cut through the marketing fluff and just sort of help runners to know what is potentially helping to reduce injuries and what is potentially helping to improve their performance. So that's what I see my sort of role when they come in, is just cutting through the marketing.
All right, our last unpopular opinion. We talk a lot about innovation, but the future of sports podiatry isn't in technology. It's in better communication, conscious coaching, collaboration, and education.
Did you write? I mean, that's probably your ethos really there, Pat, is speaking to you. But I think that's a very true opinion, and I think that the technology is probably the easy thing to reach for. The communication, collaboration, and education can sometimes take a lot longer, but actually, as good podiatrists, I think that's the thing that we really strive for, and that's what gives us kind of satisfaction when we actually get the outcomes that we want.
Agree. I mean, you need to have some empathy as a clinician towards patients. There's no doubt about it. And when it comes to the science, we come to a sports medicine conference like this, and we're learning the science, and it's really important. And our job is to apply the science and get a benefit out of this. Interestingly enough, like I just sat back, me and Pat went out for a steak with Clarkey, and I was sitting back and I was watching these two guys chat about cycling orthosis for a period of time. And, they both had these great anecdotes, examples, and this great advice for each other in terms of design and what the clinical application was. Suddenly you just have two practitioners talking in communication, and more knowledge happened in that period of 10 minutes. I was just sitting back and watching it happen, Tommy. It was unbelievable. So yeah, you can have all the technology in the world, but applying the science is still artistic and it's still human, and it's important that we realize that is a skill set in itself, and often collaboration and communication with others, we get better at that. So
this is where maybe AI cut you the art of communication, and it's I agree with the statement. If you ask my wife, I'm terrible at communication, so I've got a lot of work to continue doing to work on it. But I see the value in it, and that's why I keep working on it.
So future footprint, where do you both see sports podiatry heading in the next few years? And what do you think the biggest challenges that face the profession right now?
A big question. Like I hopefully I see a progression and of the profession into integrated into the sports medicine realm, and hopefully, like for example, this conference we had the keynote speaker of this year's SMA he's a podiatrist, and this is the first time we've had a podiatrist have the keynote address to open the conference. So I think that's a huge step in the right direction for us, and hopefully, I just hope to see it continue, and for us to keep being seen as an integral part of the healthcare system. Did you say challenges? I'll have a think. I'll give it to you.
Yeah. The one thing I would say is that there's a passion for this field, and even coming to a conference like this, speaking to people, you can feel a bit of the passion. You can see the passion through there. And our job is to be able to find those people who are passionate in the profession and give them an opportunity, give them a stage to be able to do their best and allow them to do it. Often the loudest in the room will end up being the person that seems to get the most ears to some extent, but we have some people that are super passionate and often a little bit more introverted, like a Tommy Do Canto. And every now and then it's important for our profession that we try and get these people to be, placed in a position to be able to express how good they are at what they do. And it falls over to the rest of us who are here listening to it. So I think a lot of the time we need to find those who are passionate, and we need to try and expose them to passionate environments. And that is what will make our profession pretty safe, is finding the right people for the profession that want to be here. Because the people that will be here 20 or 30 years from now, they really want to be here. And hopefully we can try and get them as much as we possibly can.
Okay, so that brings us to the end of our live recording of Soul Science, recorded right here at the ASICS SMA Conference in Hobart. A thank you to our guests, Thomas Do Canto and Michael Nitschke, for sharing valuable insights for what it takes to balance performance, resilience, and clinical excellence in sports podiatry.
Thanks for having us, guys. It was really good. I think a live recording is always fun. I sort of said to you guys at the start, I said, the goal is to try and get together here because it's fun. It feels a bit more organic as well. And I'm glad to do it with Tommy as well. So.
Thanks, Pat and John. Awesome that you guys are doing this. I tried to get this off the ground when I was on the board, and I couldn't quite do it. So congrats, and keep it up.
I know these podcasts can be quite arduous and tedious time-wise as well, but this is the Samaritan work that is important for this profession to move forward. So I'm acknowledging that as well.
Thanks very much, guys. Much appreciated.